What's up, y'all? Professor Hurley here with another episode of Purple Bear Biology. If you're new to this channel, I highly recommend you checking out the other cool videos I have on anatomy and physiology, microbiology, and principles of biology. In this video, we are going to learn some of the major muscles in the body and the movements they allow us to perform. Please keep in mind that we will not cover anywhere near all of the muscles in the body, and we will focus on the primary movements produced by these muscles, but many muscles also play supporting roles in additional movements as well. If you're not familiar with the basic movements of the body, you can get caught up by watching another video I made on basic movements. There'll be a link for it in the description section below. To explore the basic muscle names, location, and movements, we're going to be using the Complete Anatomy app. If you haven't seen this yet, check out the description section for a link. Okay, so now let's take a look at some of Carl's muscles. Let's start superior and work our way inferior. So let's start up at the face. Our face is actually divided into lots of different muscles that allow us to perform facial expressions. For example, the epicranius muscle allows us to raise our eyebrows and wrinkle our forehead. The orbicularis oculi allows us to close our eyelids and blink and wink. The zygomaticus major and minor muscles allow us to raise our lips and angle of our mouth. This allows us to produce facial expressions like smiling and laughing. Orbicularis oris allows us to close and protrude our lips. This is what enables us to pucker our lips for a kiss. This large muscle down here is referred to as the platysma muscle. The platysma muscle is one of the primary muscles that allows us to depress our mandible. Speaking of moving our mandible, when we talk about the muscles that are associated with mastication or chewing, we have a couple different muscles that help along the way. We just discussed the platysma muscle, but when we talk about elevating the mandible, we have to look at the masseter muscle. The masseter muscle works with another muscle called the temporalis muscle. Collectively, these two muscles raise our jaw in a chewing motion. In addition to these muscles, we have to have a way to protract our jaw and depress our mandible while we chew. From the inferior side of the skull, we can see muscles that are responsible for protraction and depression of our mandible. Here we see the lateral pterygoid muscle. If we look at the actual movement, you can see that deep this muscle is acting to create protraction and depression of the mandible. As we move down the body, we can actually find that we have additional muscles that are associated with moving the neck. If I hide the platysma muscle, I find another muscle called the sternocleidomastoid muscle. This allows for motion of neck flexion. If we spin around to the posterior side, we can see a very large muscle that takes up the superior portion of our back called the trapezius muscle. The superior part of our trapezius muscle is associated with neck extension and works as an antagonistic muscle of the sternocleidomastoid. Now let's spin around to the anterior side of Carl's body and take a look at some of the muscles that are found here. If we move down and take a look at the thoracic cavity, we can find a very large muscle called the pectoralis major muscle. This is one of the primary muscles involved in shoulder flexion. While we're talking about shoulder flexion, we should go ahead and mention that your deltoid plays a role in this as well. While we're talking about shoulder flexors, we might as well talk about the extensors that are the antagonists of the movement. Spinning around to the posterior side and hiding the right side of the trapezius muscle, we can see at the shoulder we have multiple muscles that help us move our arm. On the posterior side, most of these muscles help us abduct our arm or extend our arm. Starting at the top of the shoulder blade where the scapula is, we find the supraspinatus muscle. Notice that this is in the supraspinous fossa of your scapula. The infraspinatus muscle that is in the infraspinous fossa of your scapula. The teres minor and the teres major muscles. Here we can see the latissimus dorsi pulling the shoulder through extension and hyperextension. The posterior side of the deltoid even plays a helpful role in performing extension. All of these muscles collectively help us stabilize the shoulder joint. If we spin back around to the anterior side, and if we move inferior, we can see that we actually have multiple muscles that are associated with our abdomen or our trunk. The outer layer of this muscle is referred to as the external abdominal oblique muscle. As we hide this layer, we can see that the next layer is referred to as the internal abdominal oblique muscle. If we hide this layer, we can see two additional layers, the rectus abdominis and the transverse abdominis muscle. All of these stabilize your core and allow you to bend medially, laterally, posteriorly, and anteriorly. If I hide most of the abdominal muscles, we can see the muscles that are responsible for respiration or breathing. The diaphragm, which is seen here, actually flattens in order to increase your thoracic cavity volume to pull air into your lungs. The intercostal muscles located in between the ribs also serve for a similar function, contracting to increase overall thoracic volume and allowing the lungs to expand. If we spin around back to the posterior side, moving down the back, we come to our latissimus dorsi muscle. And if I hide this, we can see there are additional muscles hidden underneath. This bundle of muscles here is referred to as the serratus anterior muscles. If we spin around and take a look at Carl's right arm, we can see additional muscles that are divided up in here. On the front, we have the biceps brachii divided into two pieces. If we hide the biceps brachii, we can actually see an additional muscle that is deep. This is the brachialis. In addition to the biceps brachii and the brachialis, we have the brachioradialis. All of these muscles are associated with forearm flexion, or flexion at the elbow. And then along the posterior side, we find the triceps brachii, divided into two pieces, and is associated with forearm extension. Back on the anterior side, if we move down to the muscles of the forearm, we can find muscles that are responsible for movement of our digits of the hand and for supination and pronation of our forearm. Let's take a look at the muscles that we have. For pronation and supination, we have a muscle set called the pronator teres here. This allows us to perform pronation, where you can see the radius bone actually rotates over the surface of the ulna. While we're in this view, you can also see that we have the pronator quadratus located on the inferior end of the radius in the ulna that aids in this movement as well. Muscles on the anterior side of the forearm are associated with wrist flexion, and so flexor carpi radialis is responsible for wrist flexion. Palmaris longus is associated with wrist flexion, and flexor carpi ulnaris is associated with wrist flexion. If we will look deep to all of these muscles, we can find the flexor digitorum that is associated with flexing our fingers. If we spin around to the posterior side of the forearm, this is where we will find all of our extensors. Starting on the medial side, we can see our flexor carpi ulnaris. If we go more to the lateral view, we can find the extensor carpi ulnaris, the extensor digitorum associated with extending our fingers, the extensor carpi radialis brevis muscle, and the extensor carpi radialis longus. Okay, now let's switch from the upper extremity to the lower extremity. Here we can see the muscles of our lower extremity and how we get movement in our hip, knee, and feet. Let's start up at the coxal bone. To get hip flexion, we have muscles located on the anterior side of our body. We have a group of muscles called the iliopsis, which consists of the iliacus muscle and the psoas muscle. These, in addition to the rectus femoris and the sartorius, allow us to flex at our hip. To get extension, we have to rotate around to the posterior side. Here we have the gluteus maximus and then the hamstring group. This includes the bicep femoris, the semitendinous, and the semimembranous. To get adduction of our thigh, we have to look along the medial border. To see the adductor muscles, we have to hide some of these more superficial muscles. Here we can see our adductors, the gracilis, the adductor magnus, the adductor longus, and the pectineus. In order to perform abduction, we need to spin around to the posterior side, and again we have the gluteus maximus. Abduction now involves the gluteus medius, and on the anterior side, we have the sartorius muscle. To get flexors of the knee, we go to the posterior side, and we need to take a look at our hamstring group. This group involves the bicep femoris, the semitendinous, and the semimembranous. To get extensors of the knee, we have to go to the anterior side where we have the rectus femoris. And if I hide it, you can see the vastus medialis, the vastus intermedius, and the vastus lateralis. Now if we continue down to our leg, we now move into movements of muscles that are attached to our tibia and fibula and give us dorsiflexion and plantar flexion. Dorsiflexion is created by the tibialis anterior muscle and the extensor digitorum longus muscle. To get plantar flexion, we have to spin around to the posterior side to our gastrocnemius muscle. And if we hide this, we can see a deep muscle called the soleus muscle. To get our toes to flex, we have the flexor digitorum, and to get toe extension, the extensor digitorum is used as well. Now that's not too bad, right? Now you should have some idea of the primary muscles around your body and some of their primary functions. Let's take a look at just a little bit more information. So first off, you may find that you do intramuscular injections whenever you're in the nursing field. There are 3 primary locations that intramuscular injections can take place. It's not uncommon to get an intramuscular injection into your deltoid muscle, your gluteus medius muscle, and your vastus lateralis muscle. Let's also take a look at some of the muscles of the eyes. Notice that we have muscles that attach to our eyeball that allow us to move it superior, inferior, medial, and lateral, and everywhere in between. The lateral rectus muscle allows us to move our eyeball out away from our nose. The superior rectus muscle allows us to move our eye upward and inward. The superior oblique muscle allows us to move our eyeball downward and outward. The medial rectus muscle allows us to move our eye inward and towards our nose. The inferior rectus muscle allows us to move our eyes upward and outward away from our nose. The inferior oblique muscle allows us to move our eye upward and outward away from our nose. Now keep in mind that as you learn these, I would highly advise that you start by learning the locations and their names, and then add on movements. Once you know where the muscles are, it won't be as hard to understand what they actually move. Alright guys, well that's it for this episode of Purple Bear Biology. I hope you found this video helpful, and if you have any questions, drop them in the comment section below, and I look forward to seeing y'all for our next conversation that will move into the nervous system. I appreciate y'all coming to listen, and thanks for stopping by.